guys, it's Dr. Vidal here at Pure Plastic Surgery, and welcome to YouTube. And we're gonna have a little chat about breast implants. And today I chose a topic that is a little broad because we're talking about breast implants in general, but it's gonna answer a lot of the questions and a lot of the doubts that we usually have regarding breast augmentation, breast lifts, anything that combines a implant placement. Okay, so breast implants, there are various classifications of breast implants, but to discuss them and to categorize them easily, we can divide them into two classifications: the type of implant or the type of substance they have inside. So saline versus silicone, that's the first one, and that's the most common one. Those are the two types of implants we have in the market. Both are very safe, very good. It's more of a preference to use one over the other. So both the shell, or the shell is the covering of the implant. Both shells are made of silicone. What differences it is what's inside of the implant. So saline implants they come deflated, and you fill them in the surgery with sterile saline or sterile water, okay? That makes the implant be a little bit more soft and feels like a balloon filled with water. Silicone implants come already filled, okay? So you have to choose the exact size, and we'll talk a little bit about the differences in the profiles, the difference in the volumes, but basically they come like this, already filled with a certain volume. And then if they're made of silicone, but this type of silicone has evolved over the years, over different generations of implants. Silicone implants that were started in the 70s were very different because they were very liquid. The silicones that are now available is the 5th generation of silicone, and it's described as cohesive silicone, which means that the particles, they stick together very well, and they keep their shape even if the implant breaks, okay? So that is what we commonly know as gummy bear implants, okay? Why gummy bear? Because it resembles the shape and texture of a gummy bear. If I make a nick on the shell of this implant and I try to squeeze it out, it won't leak. If they break, saline is gonna leak and your body is gonna absorb it. So the implant is gonna deflate almost immediately, and if not, in a few days. So you're gonna notice the change in volume right away. If a silicone implant ruptures, like I mentioned, it's not gonna leak, it's not gonna lose its volume, it's gonna keep its shape, so you're not gonna notice. So the FDA recommendation is, if you have silicone implants placed, is to get an ultrasound or an MRI 5 to 6 years after you get the implants done, and then every 2 to 3 years to check for rupture, okay? And that is just a safety measure. If the implant ruptures, then it needs to be changed. But the good part is it's not gonna be leaking around the body like previous generations of silicone implants, okay? Like I said, they're very safe, okay? The difference that the implants have, it's on the shell, so the covering of it, okay? The ones that I use right now and that we're using in the United States are smooth shell, okay? The covering or the outside of the implant, it's smooth, okay? Previously, we had available, and in other parts of the world, they have available what's called textured implants, okay? If you see here, you can see the difference. I don't have here available textured because like I said, I don't use them, but basically the shell, it's textured. It has a raw surface, okay? The reason to have two different types of shells, the rough or the texture and the smooth, was because the rough or the texture one was associated with less risk of capsular contracture. So when we had them available in the market, it was really a good thing because we were seeing less capsular contracture rates. So that was a good. But problem with it is that over the years, we started seeing what's called down here BIALCL, breast implant associated anaplastic large cell lymphoma. It's a very, very rare form of cancer, a lymphoma, associated with breast implants that's been described in the last few years, let's say last 10 years or so. Like I said, it's extremely rare and it's been associated with textured implants. Hey guys, thanks for watching us. Please subscribe, comment, and give us a like.